What are the different types of pre-implantation genetic testing? Hello and welcome to Fertile Minds. I'm Nikki Kliskey, the PGT coordinator and one of the senior embryologists with the Queensland Fertility Group. Today we dig a little bit deeper into the types of PGT to understand the differences between PGT-A, PGT SR and PGT-M. Pre-implantation genetic testing, or PGT, is the term used to describe the process of testing embryos for certain types of genetic conditions. There are different types of tests that can be offered on your embryos. These depend on whether you have a known genetic condition in the family or if you carry a disease-causing mutation or chromosome rearrangement. PGT-A is offered to screen embryos for chromosome copy number and may be offered as a complement to your infertility treatment. Today we will focus our discussion on PGT that might be required for those that carry a known genetic mutation. What is PGT SR? If you or your partner have been identified as carriers of a chromosome rearrangement, translocation or inversion, your doctor will recommend that you have PGT SR on your embryos. SR refers to a structural rearrangement. If you have a chromosome structural rearrangement, you yourself are otherwise healthy, but it's very common for men or women with a chromosome rearrangement to have trouble conceiving. Some structural rearrangements in men can also be linked to low sperm counts. Although individuals with a chromosome rearrangement have the correct overall number of chromosomes, the chromosomes are packaged incorrectly. While this doesn't affect your health, the chromosome packages in your eggs or sperm may contain extra or missing segments of chromosome. This may result in a delay in conceiving or in recurrent miscarriages. A translocation can often be inherited, so you may have a family history of recurrent pregnancy loss. Can I start PGT SR treatment straight away? PGT SR is recommended so that we can check the embryos for the correct number of chromosomes. While this is performed in the same way as PGT-A, it is important that the genetics lab first review your karyotype results to ensure that any possible extra or missing segments are big enough to be detected. Very small segments will need to be tested in a different way. While PGT SR can identify embryos with the correct number of chromosomes and rule out embryos that have an unbalanced copy of the rearrangement, the technology cannot distinguish those embryos that are packaged normally from those embryos that are balanced in that they have the correct number of chromosomes but are also packaged incorrectly, like the parent. So what is PGT-M? PGT-M is the term used to screen embryos for monogenic conditions before they're implanted. Monogenic conditions are diseases that are caused by a single gene change that is inherited from an affected or carrier parent. These mutations may have been identified by previous genetic testing based on a known family history, or they may have been identified by expanded reproductive carrier screening, even when there is no family history present. So can you start PGT-M treatment straight away? There is a long list of conditions that may be tested for with PGT-M, but as each mutation is specific to an individual or couple, PGT-M requires the couple to undertake a workup to design a test that's specific for them. This process can take between 2 and 6 months depending on the complexity of the workup, and this must be completed before IVF treatment can commence. A genetic counsellor will guide you through this process. When the workup is finalised, then you may start your IVF treatment. So what are we testing for and how accurate is this testing? PGT-M will check your embryos for the known genetic condition that has been identified in the parents. The accuracy of the diagnosis for this genetic condition is usually around 98%. We do not check for any other genetic mutations, so we cannot guarantee the birth of a healthy child following PGT-M. However, PGT-M will also check the embryos for chromosomal aneuploidy to ensure the correct number of chromosomes are present in the embryo. This is not the primary aim of the test, and the accuracy of this assessment is typically between 70 and 90%. As with all PGT, we recommend prenatal testing to confirm the results. What are the risks of PGT testing? PGT requires your embryos to be biopsied to remove a small sample of cells for testing. The process for embryo biopsy in the lab is the same regardless of what type of PGT treatment you need, but the analysis of the biopsy sample is different. Embryo biopsy is an invasive procedure The embryos need to be of good quality with a high number of cells to go through the biopsy process without any major compromise. Poorer quality embryos are more likely to be negatively impacted by the removal of cells. As embryos need to be frozen to await the test results, a fresh embryo transfer is not possible with PGT-tested embryos. As with untested embryos, not all embryos survive the freeze-thaw process. The PGT-M experience is different for all couples. Please get in touch so that we can discuss your individual circumstances and answer any questions that you may have. More information can be found on our website. Also, don't forget to subscribe to our Fertile Minds channel to stay up to date with all things fertility. Thanks for watching.